Hi, Dr. Pei. We are
Hey,
back again for our
morning, D.
once a month. Ask Dr. Pei any question that you want. I am excited to be here again with you.
Thank
Um,
you. Thanks
Again,
for having me.
we are the co-founders of Tea Botanics, a high premium life stage specific tea beverage supplement company. Dr. Pei is our president. I am the CEO. He is also our chief medical officer. And that's the hat that he's wearing today in answering your questions that people have sent in early. And we will be taking questions from the Facebook page of Tea Botanics. So let's just get started, Dr. Pei. Let's see. The first
All right.
question
Let's see.
I have here is, how can I delay menopause naturally?
Hmm.
Is that even a thing?
Um, Nobody's ever really asked me to delay the menopause. They really say, how can I navigate it real good? Because I think that if you were to try to delay what is the inevitable, sometimes it's not good for you. For example, sometimes if you have too much estrogen and you get exposed for a longer period of time, well into the 50s, that actually increases the chances of breast cancer. So I probably wouldn't use the word delay. If you could navigate it through it, let the gonads semi-retire, into the sunset, that would be probably a better way to put it. Now that said, there's so many facets to this. For example, your lifestyle, your diet, your exercise, your stress level, everything is. If we were to naturally delay it, or whatever the body wants you to do, we would be taking care of all those, starting with probably, assessing yourself. Or, as a disclaimer, you got to always see your natural health practitioner or whichever doctor that you see to make sure that you're under good care.
Okay, that sounds good. So you mentioned more or less like trying to manage it. So what are some things you lightly just touched on lifestyle? Is everything lifestyle? That's my big question. Is
No,
everything
no.
okay?
Yeah,
Okay.
unfortunately, it's not. But you see, since the COVID pandemic, it's becoming more mental. People are stuck at home. They're not moving. So there is a lifestyle component. And when they're at home, they're not eating as good as they should be. You know,
Mm-hmm.
with that and the environmental toxins, obviously, when you're home, it's better you can cook. But for example, let's say environmental toxins were a factor, and then you were cooking with, say, a Teflon pan or something that is nonstick. Those could be estrogenic factors that can block your thyroid. And when your thyroid is a little impaired, it could affect your hormones. Now, I'm assuming everybody, everyone we talk about here is similar to perimenopause, menopausal, but this actually affects everybody. So stress would be a major factor. We might have to address that because people ask me, "Hey doc, you always talk about de-stress, de-stress." Okay, besides listening to heavy metal music, no, I'm kidding. Besides listening to jazz or some other music, what else can you do? And I think I have an okay solution for most folks to follow because whether you're religious or not, people can accept this type of mentorship or this type of instructions to follow just to get a better handle on their daily stresses, work stress, home stress, kid stress, all that. So we'll probably touch up on it later. Trying to get through more questions first, I guess.
Okay. Yes, I want to come back to what you think are some stress
Yeah, a
relieving
de-stressor. Yeah.
de-stressors. It's interesting. I've had to take during COVID, I've probably have taken a total now of 10 flights. But the last flight I just took, which was about a week ago, I really felt um, overstimulated, right? And I'm an avid traveler, meaning avid business traveler. So I've, you know, seeing a bunch of different kinds of people is not a big deal. But for some reason, this last flight, and it probably because it was the first time where it was completely packed at the airport, packed on the
Mm-hmm.
plane, right? And I was traveling to Atlanta, so a little longer distance than I have been. And I felt overly stimulated by looking at so many different kinds of people because I've been in a bubble for the last 15 months where I'm not really
Mm,
seeing like a diversity of
mm.
people that it really like, I felt anxious. Like I couldn't wait
Yeah.
to be boarding the flight. Like, can we board this flight? Right.
Or can you get off of
So
it?
many people. Right. So something just as simple as that, where I never get stressed from traveling,
Yeah.
but because we're coming back into environments that we've been removed from for such a long time. So we'll
Yeah.
come back to that.
But that's where I
Yeah,
say drink some tea. Any
yeah,
type of tea, in this case, would be a mood stabilizer. Is that tea or coffee?
it's tea. Tea. I'm not a coffee. I've never been a coffee drinker.
Yeah. Yeah, drinking tea will stabilize it. But then,
Okay.
I will address that part too with the type of little prayer that you can do that people can all follow
Okay.
to calm
Perfect.
the mind down.
Okay. My doctor never really asked me if I was in menopause and has never explained the process and if I should take hormonal drugs. Is there anything I should be doing? Are there tests that I should take to understand where am I in my, hormonal state?
Okay, that was
Um,
you, or is that the question from the
this is
audience?
the question.
Oh, okay.
But
Yeah.
basically, doctors, and we find this all the time. I find that doctors do not start talking to women at all about perimenopause or menopause, right?
Hmm.
Um, they it's like no conversation is had. You can look at this patient and go, okay, at minimum, if somebody's 46 or 47, they're in that stage. And the doctor is not proactive and saying, what the standard 34, I've counted 44 symptoms, but the standard 34 symptoms, even just asking about, how are you having any challenge? Are you having any night sweats or hot sweats? Are you having any vaginal dryness? Any problems with sex or any pain? Or just, the doctor being proactive to ask that. We just not seeing it, which is why so many women, are left, really frustrated and feeling like the whole situation is out of control. So kind of
Sure.
back to the question, um, hormonal drugs. Can you talk a little bit about hormonal drugs, um, bioidenticals, and then are there tests that a woman can take to give them a sense of, am I perimenopause now?
Yeah. You know,
Okay,
the truth is, we really talked about them. It's just that we tend to blame everything on perimenopause and menopause instead of talking about it. So what happens is there are tests. For example, when you know you're not ovulating as much, your follicle stimulating hormone, it's called FSH, that should start to spike up. And if your blood test shows that it's consistently up, then okay, you're probably approaching that. Of course, menopause is only taken one day. Once you know that you haven't had your period for about 12 months, you can probably declare yourself menopausal. And then postmenopause is all the period behind that. And usually after 12 months of no period, we're pretty sure that your progesterone is starting to shift downward. So instead of your ovaries producing most of it, now it's going to shift your adrenals, which means that's the part where, okay, all the ladies need to take care of their stress level. Again, we will show one of those tricks or techniques. As far as the estrogen, because your fat cells, adipose tissue, still make them from the aromatase cells, your fat cells. So the chances of having low estrogen is a little bit lower, but yes, there will be times where most ladies are running out of estrogen and progesterone. And because I don't do bioidentical hormones in my office, usually we run the test and then we'll see if our natural remedies such as herbals and nutrition can cover it. If that doesn't cover it, because some ladies that we see, they're almost at zero levels. So then we would send them out and they have to use bioidenticals, stuff that would resemble as closely as possible to natural hormones. Like, for example, I would be using wild yam or chase tree to see if I can boost that progesterone and balance the estrogen, because sometimes you could have both estrogen and progesterone being low, but estrogen is still too high, so that becomes a dominance. So we call that estrogen dominance. You want to be able to support both estrogen and progesterone as we go in there. Some of the medications, I don't want to bash them, but like say Premarin, sometimes they use horse hormones. I mean, anything other than humans, it's really not for humans. For the same reason, we kind of don't want to eat foods that are high in hormones because, I mean, let's say dairy. The calves drink milk because it's for them. The protein level, the mineral levels are at least 10 times higher than that for the humans. Therefore, for us, there's probably not too much benefit in drinking it other than stressing out our pancreas, which has a relationship to your adrenals too. So when you hit menopause or perimenopause, you really have to watch out for two things: your adrenal health, which is your stress and other nutrients, and also your blood sugar. Digging two holes there, so we'll try to talk about those two things later. So that is the question.
Okay. So let's okay. So I've got a question that's going to lead into the blood sugar uh,
Okay,
that you mentioned.
yes,
How
we'll
do
talk
I get rid of belly fat?
belly fat. Okay, we were talking about menopausal
Yeah.
lady, right? Okay, so first things first, we got to make sure this person or lady is not eating all kinds of bad sugar. What I mean is candies, cakes, cookies, ice cream, soda, that type of thing. Once we know the person is eating pretty well, then we start to look at, all right, does a person do exercise? Is the person sedentary? Office job, 9 to 5, but sitting there, never moving. That's not a good thing. Food portion size. Do you eat a lot? I mean, if you eat big meals and the food combination isn't correct, then that's bad. When your stress level is high, that's also bad too. So, for example, when your stress level is high, your cortisol goes up like crazy. When cortisol goes up, it's going to be stimulating your liver cells to release or make extra sugar. So that means high cortisol, high sugar. When there's high sugar, your pancreas will start to release insulin. I think everyone knows this. Insulin will drop that sugar level in the blood so quickly that your cortisol will now rise again. It's a vicious cycle where whether you have low blood sugar or high blood sugar, your cortisol will rise. This will create a stress response where they accumulate fat in the abdominal area. So let's say you're into high intensity interval training because it really does help you burn the fat. But there's a few caveats. If you're stressed out, that's not going to work. If you eat poorly, that's not going to work. If you're anemic, that's not going to work because you just don't have the minerals, the cofactors, all those to help you shed the fat when you're anemic and under nutritional. So therefore, the accumulation of fat, you have to look at all facets. This is where you have to go see your doctor. Say, hey, are we covering all bases? Am I accumulating fat cells or am I accumulating toxins? Is it because my thyroid is underactive? Is it because my adrenal stressed out? I mean, there are so many factors, but that is the blood sugar. So in summary, it's a little confusing, but just remember this: cortisol is the stress hormone. When that's high, the blood sugar will start. If blood sugar was low, it will now start to go up. Any excessive sugar that your liver cannot handle, it'll be um, allocated to your fat cells. So then it'll be stored as nutrients in the fat. So you get bigger and bigger. If your sugar was already high to begin with, your insulin will kick in and then it will drop it drastically, which in that case, it'll start to cycle. Your cortisol will go up again. So it's a lose-lose situation because once that cortisol stays there for a long time, you might now have to consider insulin resistance. Your cells may not even take in the insulin and your blood sugar will remain high. This is why sometimes the lady goes in the office, hey, doc, I don't eat sugar, but how come my blood sugar, A1C, everything is so high over a few months, but I eat clean? Well, that would be the stress level. Is that a little confusing or you think I answered that one?
No, that's I need a PhD for that last conversation, but that's okay.
No, it's very confusing. Just remember, low blood sugar, you're going to raise the cortisol. High
Uh-huh.
blood sugar, you're going to raise the cortisol.
Okay.
So my solution to that is if you're knowingly stressed and you know that's been going on for a while, this is where they recommend you eat smaller meals throughout the
Uh-huh.
day. Instead of three or two big meals, you want to do fewer, smaller meals and not too high in sugar to balance the adrenal so that your blood sugar can remain there and your cortisol can remain there. Another point I want to bring out, because people often, when they're stressed out, they can't sleep, right? You know how they wake up middle of the night? That's a blood sugar issue too. For example, let's say you go to bed and you're like, you know what, I gotta have a piece of cake before I go. Okay, that's bad sugar. That's actually bad sugar fat combination, right? We talked about this in the past.
Right.
When you eat those, your blood sugar will spike and insulin will have to kick in quickly to drop it down. But remember, when you eat the sugar like that, your melatonin doesn't really kick in. You can't fall asleep right away. Or you go into a sugar high and you could fall asleep. But once the insulin kicks in, your cortisol will start to release probably 3 a.m. or so, and that's when you wake up. And you go, whoa, I'm wide awake at 3 a.m. Why? Sometimes it could be your liver because that is the liver meridian time, but it could be your blood sugar where your vitamin B, B as in boy, vitamin B levels are really low. Cortisol kicks in, you're wide awake. For that reason, when they wake up after that, their cortisol levels are going to be low and they're tired as heck. So this is the vicious cycle. You see how that relates to blood sugar and adrenals?
Mm-hmm. Yeah.
Yeah.
And a lot of women have that problem. And a lot of women also, older women, I mean, all women and men drink wine at night. But a lot of people start drinking the wine as a stress reliever, right? So you might start off with one glass, then you starting having two glasses, and you're doing this before you go to bed. And I've had a lot of women say, I can't stay asleep, or I wake up at such and such time. And I'm like, well, do you drink wine at night? And they were like, of course. I mean, so,
I'm,
it's tough that when, it's tough when that's something you're doing every night, because now you've created a habit, to change that habit. And then to also recognize, what happens after you change that habit, right? That you
mm,
actually do start to fall asleep, you do start to stay asleep, but getting to that path is a little tough. Okay,
I
next.
mean, I have to disclaimer again. I'm not gonna bash all wine drinkers. I mean, I used to be a bartender before this too,
Uh-huh.
long time ago. But I stopped drinking only because I know the body cannot handle that type of sugar conversion. It is a sugar alcohol that we can't really convert into energy, so the body keeps trying to do it. So we've done some experiments where it actually takes roughly 3 days for the body to process that alcohol, and then not to mention the fermentation. So of course I don't drink beer, but when you think about it, mm, besides calming the mind, I am not sure what it's good for anymore. Not to mention that it's one of the more toxic elements in the world, right? But yeah, when you think about it, a bottle of wine, 2 cups, that's more than half a bottle. I think it makes something like 3.5 cups, right?
Mm-hmm.
Yeah, that's more than half a bottle. If it takes you 3 days to process it, and you say, Doc, I only drink twice out of the week. Well, 3.5 days times two, that's your whole week.
Mm-hmm.
Not a good outlook.
Okay.
So I
Okay.
try to tell people, but I'm not gonna bash them though. Don't attack me, please.
I'm not going to attack you, because I have Friday night drinks that
One time a
I'm
week, all right?
that I'm
All
not
right, close
giving
my
up,
eyes.
But I have gone long stretches, months and months and months without drinking, and I do see and feel the difference. Definitely, I'm athletic, so in my running performance, stuff like that, I definitely can see the difference.
Yeah, for sure.
Okay, so next question. How do I get rid of hot flashes when I've had a full hysterectomy? So this person is saying they had a hysterectomy 10 years ago, and now they're having hot flashes.
Okay. So full hysterectomy means the ovary's gone too. You know,
Yeah. Yeah.
when that's gone, now everything is back to the adrenals. Remember, when your stress level is high, that creates a cytokine storm, which means your immune system is lower and it's working kind of overtime. So a hot flash is when your immune system gets overloaded and then your hypothalamus goes into haywire. And also your pituitary now is getting a little confused because it doesn't know what to produce. But a lot of the times the prolactin goes up and that suppresses the immune system. So therefore the hot flashes will be due to, in combination, some stress, some viral component like viruses, and some heavy metal component. If it is due to a strict nutritional problem, you know you're missing fat. like good fat. I don't mean the bad fat, from eating candies, cookies, ice cream, soda, and stuff like that. But I mean like you're missing good fat. To convert good fat, the way that you eat, of course, you have to be able to digest it. So that comes down to eating good veggies, green leafy veggies that can emulsify the fat that you eat so you can absorb it. For example, vitamin D. Everybody thinks, oh, I'm a jock. I go to the sun all the time. I'm on the beach. Well, if your omega-3 is really low, your cholesterol is going to become a little low. And then when that's low, you can't really convert the UV light into the makeup of vitamin D. Like you can't really make the conversion. Well, therefore, that's why you're in the sun all day, but you end up with farmer skin. You can't have the vitamin D conversion. So those three components, the nutrition, the viral, the heavy metal, the hormonal, all those are related. If you drink the tea, technically it's the mood stabilizer, like the tea that we make. It's designed for the GABA pathway. It'll calm almost every single person on earth down. But some people, if their fatty acids are low or if their gallbladders are impaired, meaning their digestion of fat is impaired, then they actually will have an increased hot flash when they drink any type of tea, whether it's caffeinated or not. But yeah, more caffeine will create more of those.
Okay, great. Next question here is I'm dealing with incredibly heavy periods. Is there something that can be done?
So
And
that depends. Yeah, go ahead.
so I was just going to say that that's one of the things that starts to happen is women's periods start to change. So some women find that they're all of a sudden they never had heavy periods and now they have heavy periods.
Hmm.
And that really bothers them because I think if you've never had a heavy period, you're not really even prepared for how you have to constantly be prepared because
Yeah.
anything at any time, can happen. So what can those women do?
So that those ladies need to make sure they consult their healthcare professional because sometimes, I mean, even though we say perimenopause or menopausal, they could still have fibroids. Fibroids would be one of the reasons, major leading reasons for heavy periods. If they haven't had a heavy period for a while and then it starts happening, it could be their liver, their methylation is impaired, meaning they can't really detox the phase one and phase two toxins, or they're just estrogen dominant, meaning if they're in the perimenopausal side, their progesterone goes down. Because when you have a low progesterone, sometimes you will start to accumulate, and then you have a less frequency occurrence of periods. So when you don't have period for a long time, they accumulate. The linings will shed, and you get heavier period. Another reason could be just the radiation. I mean, the amount of electronics that we use, it's increasing. So radio frequency from microwaves and from computers and the 5Gs, they tend to increase that issue a little bit. So we've noticed that too in our patient base, where they're bleeding a little bit more, especially the perimenopausal menopausal, and they just can't stop it for some reason. So here, if I was checking, I would check everything. I would check also for their how do you call it, their vasculature, to make sure that their blood vessels are intact and not too thin or easily ruptured. So there are many things you have to look at, but I would say for sure they need to go see their healthcare physicians because you don't want to become bleeding so much or you're anemic.
Okay. Next question. What is the best vitamin combination to take to
Hmm.
maintain an active lifestyle?
Depends on how active. What are they trying to do? Any ideas?
Well, let's use myself as an example. Like
Huh?
somebody who exercises say 5 times a week, right?
Okay.
And they've been doing that, but now, as we get older, we know we need a little more something, right? So
Okay.
what kind of vitamin combo for an active person would do they need to make sure that they're having?
Like in this age group, though, at least, right?
Yeah, in this age group. It
Okay.
definitely like say the 35 plus.
Okay, 35 plus. Well, you got to make sure you have omega 3s, which good fats. You want to have all your vitamins accounted for. Vitamin D, first and foremost. But vitamin B complex, B as in boy, is key because that also takes care of your adrenals. Vitamin C is a must also because, as I mentioned, when you go into a semi-retirement of the ovaries and uterus, the adrenal picks up the slack. Adrenals, a lot of people don't know, they house about 70% of our vitamin C levels. So you got to make sure you have vitamin C. Under this current climate, there is a caveat. So I don't give vitamin C to everybody, okay, for a specific reason. But I would at least tell them, please eat your fruits to get the vitamin C. Get your veggies and your fruits to get the vitamin C. But for now, I am not giving some of the folks vitamin C. Just know that it is an important component to your adrenal glands. You need your vitamin B's, or A's, B, C's, D's, okay, for your adrenals and your fat. And for runners such as you, I would probably make sure I check mitochondria because that's your powerhouse. A lot of people also need to know that the mitochondria, when you get into the 40s and 50s, they are the ones making water for your system. So if your mitochondria is not working properly, not only will you be tired, you're not making enough liquid. So when you're not making enough liquid, you'll be dry too. So that's another way to see whether you're low in fat or water. You know you're low in these components. So that's what I would say. Mitochondria, I would use humic acid, humic fulvic acid. That's one of the best ones to use because it's considered a mineral, but it also can help you extract toxins safely without the chelation risk and all that. Let's see. So humic acid, the vitamins, minerals. Now the minerals, I can't tell what people need. Obviously, all the basic ones: calcium, magnesium, zinc. But I usually give patients trace minerals, especially their hormones are a little off. So the trace minerals I must test. I can't just give everybody, hey, you take this mineral, because even in magnesium, there's like 23, 20, 27-ish different forms of magnesium. So those
Wow.
things I would test. Even vitamin D, there are different forms. So the person says, you know what, I am taking vitamin D, but my vitamin D is still low. Well, for one, I know your omegas are probably low, or you just need to eat some mushrooms because the mushrooms have the D2, not the D3, but the D2 that are good for your hormones. D3s are good for your hormones and immune system, but you can get different forms of the vitamin Ds. So, yeah, minerals, vitamins, humic acid, omega 3s. There are antioxidants, which it's too specific. I probably can't even name it. But I would say anything in the vitamin E world couldn't go wrong. You just got to have a very natural source, whether you get it from your nuts, your raw nuts, or you get it from a supplement form. That should be okay.
Okay, perfect. Okay, so we're going to end with you telling us how to de-stress. What
Oh,
are some things we can do? We're at the end of the
okay.
30
Oh, that
minutes.
was fast. Okay.
I
So
know.
everybody wants to know how we de-stress. Obviously, we come from a very sports like family, athletic family. We like to play sports. But let's say you just can't. Like you can't play sports, can't listen to music, you can't draw, you can't read, but you believe in prayers. Okay, well, some of the prayers that people do don't necessarily come true because the way they do prayers are somewhat more selfish. I don't mean that as a denigration. I mean that in a good way, where please help me get rid of this. Well, the way you would phrase that is negative, therefore it doesn't come true. So the way we've been doing this de-stressor, I've been doing it for over 13 years. It's called Ho'oponopono. It's a Hawaiian way of de-stressing, where you're really just reciting or chanting these four phrases in your mind over and over. And whether you believe it or not, and whether you say it or not, the resonance, the frequency, vibration of these words will carry the power and it'll do the job because you're not really doing it for a selfish reason. So I can say the four phrases would be not in any particular order. I'm sorry, please forgive me, thank you, and I love you. If you say these four phrases over and over, whether you believe it or not, it's gonna turn things around because that'll neutralize first your negativity, and then two, it will send a signal to the universe and back quickly. Your body will start to generate that vibration because if anybody who's read Dr. Masaru Emoto's book on the water crystals, you'll know your thoughts are power. When you think about such words, even if you don't say it out, it'll carry that frequency into a water crystal, and it will generate a nice symmetrical crystal. Same with your mind, same with your cellular makeup, your organs, your systems. Everything is based on that frequency vibration. So if you know you're in a negative state, just go ahead and say those over and over in your mind. Because if you keep saying it out loud, people might think you're weird. If you just say it in your mind, it will start to change your uh, brainwave, at least back to, if not to a theta state, it'll be back to at least an alpha state. So people will start to ask me, Doc, why do I have to say, please forgive me? I didn't do anything wrong. Well, sometimes you just surrender, right? You're not saying forgive me because we all have sins, but I'm just saying that let's go. It's a feeling of let go. So whether again people believe it or not, try that. Try those 4 phrases and just say it over and over. You'll find that a lot of things happen in a positive sense. That's a good way to de-stress.
Okay, great. So that was I'm sorry,
Please forgive me.
please forgive me,
Thank you,
and
and I love you.
thank you, and I love you. Well, I want to say thank you, Dr. Pei,
You're
for
welcome.
this great conversation. And I also want to say that I love
Oh, thank you, thank you. We
you.
love you all, but thanks for Dee for all the support over the years.
Of course, of course. So we will be back again. I don't know what the date is, but it's June.
It's a
And
little shortened this time, I believe. There was a schedule change, so it's not too far away.
yeah, not
So
too far away. Yeah, I think
they
it
don't
might
get
be.
tired of listening to me. I guess I'll
I,
see you back in a couple of
no,
weeks.
it's always no. You always are dropping interesting knowledge.
Hey,
So
little
no,
nuggets,
we are
hopefully.
very appreciative. Thank
Sounds good.
you.
Okay, we'll talk soon.
Okay, bye bye.